Do you frequently feel like your heart is pounding, even when you're just sitting down? Or maybe you get tired so easily that even walking to the fridge feels like a workout. Imagine your body not making enough red blood cells, the tiny helpers that carry oxygen in your blood. When that happens, your heart must work harder to pump oxygen around, and you feel weak and pale. That's what happens in Diamond-Blackfan Anemia, or DBA. It's a rare problem mostly seen in babies, where the bone marrow, the factory inside your bones, doesn't make enough red blood cells. Think of it like a toy factory that only makes trucks and forgets to make cars. In this case, your body keeps making other blood parts, but forgets the red ones. So why does the bone marrow forget to make red blood cells? Most of the time, DBA is caused by a small mistake in your genes, like a typo in a recipe book. These genes usually help build ribosomes, the tiny machines, inside cells that make proteins. If the ribosomes don't work right, red blood cell production gets disrupted. About 80% of DBA cases are due to these gene changes, and many of them are inherited, meaning it can run in families. But here's the twist: sometimes a child has DBA even if neither parent has it. That's because the typo happens all by itself when the baby is forming inside the mom. Think of it like downloading a game, but one file gets corrupted by chance. It wasn't the game maker's fault, just bad luck. Now, how would you know if someone has DBA? Babies often show signs in the first year, looking very pale, getting tired quickly, or having a fast heartbeat. Some babies may even have physical differences like a smaller head, wide set eyes, or heart or thumb problems. Imagine two twins. One is full of energy, always crawling and playing. The other seems sleepy, breathes fast during feeding, and looks paler. Doctors would start to wonder about DBA. If untreated, a child might grow slowly or face heart strain. The biggest clue: low red blood cells, but normal white blood cells and platelets, like a store with plenty of apples and oranges, but no bananas. Diagnosing DBA starts with a blood test. If red blood cells are too low, doctors do a bone marrow test, a small sample taken from the hip bone to check if the factory is broken. They also look for gene changes. Now, treatment isn't a cure yet, but it helps. Steroid medicine, like prednisone, can wake up the red blood cell production in many kids, like pressing a restart button. But not everyone can stay on steroids forever due to side effects. For them, blood transfusions, getting donated red blood cells, are a lifeline. And if the body keeps not making red cells or side effects get worse, a bone marrow transplant might be an option, the only cure we have, but only if a good donor, like a sibling, matches. Think of it as replacing a broken factory with a fully working one. Right now, we can't prevent DBA because it's caused by gene changes, either inherited or random. But if a family already has one child with DBA, they can talk to a genetic counselor before having more kids. It's like checking the instruction manual before building another model. The counselor can test the parents and predict the chance of another child getting DBA. While we can't stop it before it happens, catching it early helps, so doctors watch newborns closely, especially if there are physical signs. Early help means fewer heart problems and better growth. Even though DBA is rare, scientists are making progress. One cool idea is gene therapy, fixing the broken gene in a patient's own cells and putting them back, like editing a typo in the recipe and rebaking the cake. Early trials are testing this. Another advance is ribosomal targeting, giving drugs that help ribosomes work better. Also, researchers are looking at why some patients respond to steroids and others don't, to find smarter treatments. Imagine a future where a child with DBA gets a one-time gene fix and lives normally. No transfusions, no steroids. That's the goal, and we're moving closer.